Hello everyone, it's me, Dr. Whimsy, and today we're tackling healthy menopause, that change that every woman begins to go through if we are lucky enough to get old enough to do so. We get to go through that wonderful thing called menopause. Yay! We get to join the sisterhood of women going through menopause. So we're going to conquer it. These are the 5 top challenges of menopause. In 10 minutes or less, let's see if I can conquer it and what we can do about it from a naturopathic perspective. When I talk about the top 5, I'm talking about the top 5 reasons why people come to see me when a woman is going through menopause. Let's do it. Number 1, top reason women come to see me is weight gain. Why? Is that not a surprise? It is true that when we go through menopause, we can sometimes see changes, fluctuations in weight, particularly around the belly area. This is a natural process. It happens because metabolism can decline, also estrogen, progesterone levels decline, and one of the ways that our body is able to compensate is by producing estrogen in other parts of the body, like in the fat cells. So it's not unusual that our body will take on more weight and begin producing estrogen from fat cells rather than produced from the adrenal glands, are where we see precursors like DHEA, and then in the ovaries is where we see estrogen and progesterone production. So that changes as we get older and the ovaries are no longer producing an egg. So weight gain, absolutely one of the number 1 reasons people come to see me. Number 2 is poor digestion. I cover this a lot in previous videos. Big challenge after the age of 40, even if you're not, excuse me, a menopausal woman. That's because pancreatic function can decline, poor dental health can be a factor. I didn't mention it in the last video, but this is definitely associated with menopause. You can have dry mouth, poor saliva quality, skin feels drier, and that also, people feel drier as a whole, women do. And this can also lead to poor quality saliva, and that can impact the digestion. Number 3 is hot flashes and night sweats. These can be so severe that they can impact sleep quality. And in addition to hot flashes and night sweats, I would add to that poor sleep quality or changes in sleep. People may feel that they need to sleep less, or they may be changing their patterns of sleep, where they might have been a night owl before, dancing the night away till 2, 3 in the morning. Now they may feel like they're crashing at about 9, 10 o'clock at night, and then not necessarily getting the best quality of sleep, waking up intermittently throughout the night. One of the other reasons why people will experience intermittent sleep challenges with sleep have to do with the fact that they also have frequent urination at night. So that's one of the reasons we see sleep disturbances. Mood changes, also not unusual that we'll see that. Feeling emotionally labile, crying, depression. I think a lot of that is not hormones, but may actually be a response to how the culture as a whole treats women over the age of 40, which is one of the reasons why I speak very openly and honestly about encouraging women not to look at beauty magazines, or at the very least temper it, because images, and usually they don't have women over the age of 40 in those magazines. They kind of encourage women to disappear in Hollywood after the age of 40, so that it's almost as if we become invisible people in this society, and nobody wants to feel invisible. We all want to be seen. We all want to be loved. We all want to be wanted and nurtured. And so the fact that this culture doesn't do that can be a source of incredible pain for many people, but I think it's very difficult for women. It's difficult for my male patients as well, particularly my male actors, but as a whole, I do think women suffer from that more. And finally, number 5 is poor sex drive. As I had mentioned, drying out of tissue, skin becomes drier, saliva production decreases, and also poor sex drive. So how do we deal with this? What do we do as naturopathic doctors? The first thing we do is we get a really good, thorough intake. We want to know the patient, find out what's going on with the patient, what the unique challenges are of the patient, what are the goals of the patient, what is she hoping to achieve from her program that she's entered into. She's ultimately in charge. It's her body, it's her life, and we are there to facilitate and support that process of healing. The second thing we do in addition to an intake is we do a physical exam. We want to know that nothing physical was missed. My physical exams are pretty straightforward, nothing that any other doctor wouldn't do. With women over the 40, we definitely want to check heart health. Unfortunately, a lot of doctors have ignored the challenges of heart health in women, and we know that that's something we really need to be focusing on. So blood pressure is taken, heart exam, digestive health is taken a look at, thyroid is looked at as well. And then we run labs just like any other doctor. I look at thyroid, of course. I do a saliva test on thyroid, I do a saliva test to look at sex hormones, cortisol, DHEA, but also the 3 types of estrogen and progesterone and testosterone. Declines in testosterone are associated with loss of muscle mass in women, but also sex drive. And then we build a protocol. After we get everything together, we build a protocol. I like to start with least first, which is number 1 with the diet. And I find simply by removing things from the diet, we may see some improvements. So number 1 thing that I address is diet. With diet, you can see improvements in weight, mood, hot flashes, etc. So what are the things that I'm more than likely going to remove from the diet? Alcohol, number 1 on the list. You can have your red wine if you like it, but understand that when you consume alcohol, it's not unusual to get a hot flash afterwards. Caffeine is another big one. People will love their coffee, enjoy your coffee, but understand that after you drink it, you could have a hot flash. Too much sodium, never a good idea, particularly if you're battling blood pressure challenges. Sugar, processed foods, also empty calories in general. It's not going to help you if you're trying to maintain a healthy weight. And so what do we add to the diet? Usually I look at diets like the anti-inflammatory diet. I never tell a patient they cannot eat a particular food. I simply give them a baseline. I like to do a measurement of the waist to find out what the BMI is. I know the BMI is not perfect, but taking the patient's weight and getting a BMI, getting a good measurement on the patient helps me figure out basics like how to monitor caloric intake, etc. And then we start to talk about the fun things like supplements and herbs. I do usually pick a multivitamin that I like. I try to go with a professional line or a food-based vitamin. I do believe in multi-minerals. I think they're very important for women, particularly as we get older. And I do check vitamin D levels in women. Very important, not just for the immune system, but for the bone health as well. Omega-3s, a great addition. It'll help with brain health, brain fog, which I did not mention, but certainly it could be on this list. But it also helps with skin health, cardiac health as well. And I try to get a good brand usually. I do like the herbs, and I usually will start with herbs excuse me, before I move on to something a little bit more advanced, like advising something like a bioidentical hormone. We certainly could do bioidentical hormones, but if a patient is willing and young enough, we do move on to herbs. I like tinctures. I think tinctures are very effective. Here is a great company. I don't work for them. Wise Woman Herbals. I think they have great stuff. that's definitely a direction that I go in. For pills, there are some great companies out there that offer great pills. This is a good company, Vital Nutrients. It's also a company I use a lot. Again, I don't work for these companies, but this is just stuff I have in my office. There are some things you can get over the counter. For example, DHEA, which is a precursor hormone. We sometimes will recommend that depending upon labs. And to support digestive health, there are also things we like to add. Pancreatic enzymes are a great idea if we see poor pancreatic function. Good old-fashioned probiotics. And here is a great thing I always like to talk to people about. Trifol or Trifala, usually best taken right before bed. It helps with symptoms of constipation, gas, and bloating. It's an Ayurvedic herb. It was discovered from traditional Indian medicine. Okay, in terms of poor sex drive, that I do get good responses by prescribing vaginal suppositories that contain things like estrogen, DHEA, and sometimes testosterone as well. Those I usually, I want to get a baseline, check the hormone levels before doing that. There are some other things we can do for that as well. All right, that about wraps it up. That was really as fast as I could do it in a little over 10 minutes. Be sure and let me know what you think about this subject, and if there's any other subjects you'd like to conquer, and also what your challenges are going through the change. Anything positive that you think is also going on with menopause? I'd love to hear about that. I'd love to hear positive menopause stories. All right, if you like this video, be sure and share, like, and subscribe, and thanks for watching. Take care. Bye-bye.